The first one is Professor Ben Brik, Associate Professor of the Hamad bin Khalifa University in Qatar, who will talk about the survey on the impact of the pandemic on family life, and Professor Bahira Trask, who's chair of department at the University of Delaware. First, we will have Anis. Anis, let me remind you that you are to speak now just for 15 minutes, very sharp, so that we have time for questions after. Thank you. You have the floor.
Thank you, Ignacio. Hello, everyone. I'm so happy to be with you here. Thank you, IFFD. Thank you, Ignacio, Alex. I'm happy to see Renata, Kinga, and Bahira. So thank you again, IFFD. I'll try to talk about research I'm leading now with the partners and colleagues on the impact of the pandemic on family life across culture. So this is a preliminary results. The survey is still ongoing, and the data collection will end in end of this month. Next slides, please. I don't know if I have them. So I'm going to talk today about I give you a brief overview of the study.
Sorry, I think you have control of your keyboard. You can change the slides yourself.
Okay.
I'm told.
So I'm going to talk about give you a brief overview of the study, the objective, the methods, and very brief preliminary result on the impact of the COVID on type of family. And I've been asked to talk about the intergenerational solidarity. So the study is an international research project that explore the effect, as I said, of the pandemic on family life, to track the patterns of symptoms and causes and risk factors of mental health on parents and children, and try to understand the experience of those parents during the pandemic and identify their needs in terms of policies and services, and to understand how those families and children cope with the stress of the pandemic. So if you are interested, you can visit our website, the website of the study, which is covidfamilylifestudy.org. Specifically, we try to analyze and understand and identify the prevalent stressor, specifically of depression, anxiety, and PTSD, and to explain and analyze what are the factors worrying parents and children during the pandemic, and of course analyze their experience, the experience of parents and children, and identify their needs in terms of policies and services. So the study was conducted using an online survey, which we started in May 2020. The study was translated into 18 languages, from English, Chinese, Greek, German. So you can find all the survey in the website. We targeted parents with children of parents or caregiver of children of less than 18 years old. As you can see, as of today, 56 countries has been surveyed. In Europe, 18 countries: Germany, Holland, Spain, France, Portugal, Romania, Poland, Hungary, with the help of Kinga Jo here. And thank you, Kinga, for helping us. In Asia, we surveyed China, India, Singapore, Malaysia, Indonesia, Mongolia, Philippines, Australia. In Latin America, Brazil, Argentina, Mexico, Colombia, Chile, Bolivia, Venezuela, Ecuador, and Peru, and so on. I mean, in Africa, we surveyed 5 countries. In the Middle East, 13 countries. In North America, the US, and Canada. Of course, I mean, thanks to our partner and the research member, and great thanks again to Renata Renata has been always supportive of family research. So as you can see, we have a large number of partner, DESA through Renata, the Whitley Institution in the US, ILFAC, and well-known, the European Large Family Organization, the German organization, partner in Africa, partner in Sweden, in Australia, in Italy, in Spain, and also I would like to thank IFFD and specifically Ignacio and Alex for helping us in promoting the study. So as of today, as of this morning, we received 48,356 response from all over the world, from 5 continents, 56 countries. Almost 50,000 families replied to our survey. So I'm gonna walk you through very basic, very brief results. So we asked, so most of the respondents are, as expected, women. 68% of the respondents are women, and 30% are men. The second factor, I mean, we asked a lot of questions. We asked specifically 32 questions covering demographic factor like age, gender, nationality, income, education, employment. What happened with I don't know what is happening there. Number of children, etc. So there were a large number of demographic factor. We asked also questions related to the mental health of the parents, the mental health of the children, the marital relationship, how they're dealing with the partner. We asked a question on family resilience, how they're coping, and how they're satisfied with their life, and what they expect from governments and what their needs. So here another factor, which is their marital status. I don't know why he's moving here, but 83% of the respondents are in relationship, and few, as you can see, few are divorced and widowed and never married women. So the majority of respondents are in relationship, parent of children less than 18 years old. So as I said, I've been asked to talk about intergenerational solidarity, and in the survey we asked the question, we asked the parents whether they have a caring responsibility for elderly, in addition to their children, whether they're already caring now old people, relative old people. And now this is an aggregate result, so including all countries, 56 countries. Of course, there are differences between countries and region, but in aggregate, in average, 27% of the respondent out of the 48,000 respond have a caring responsibility. They are caring, actually, currently they are caring for old people. So I'm gonna focus only on the 27%, those family who are already caring for children and an old person in their family. And I will focus specifically on their mental health, their family satisfaction, and their needs. So we asked those parents a question. We used a scale. We used a well-known clinic measure, a clinic scale to measure depression, anxiety, and stress. So as you can see here, so here in this slide, I'm comparing family who are caring for elderly, who said they're already caring in addition to their children for old people, and those who are not caring for elderly people. But in general, as you can see here, the majority of the respondent, whether caring or not, they have less mental health, less depression, anxiety, and stress because of the pandemic. So as you can see, the percentage maximum of 35% of those of the respondents said those questions apply to them, meaning they already feeling stress, anxiety, and stress. But as you can see here in color blue, that those families who are caring for elderly felt more depression, more anxiety, and more stress, which is expected. I mean, you expect to already have stress dealing with kids, with their children, in addition to one of the relative and old people, which is expected here. The next question, yeah, we asked it. I mean, as I said, we asked many questions, but I just focus only on those three factors. So we asked the question related to their family satisfaction. To what extent they are satisfied with their family, with the communication with the family and relationship with the family. And as you can see, in average, in total, most of the family surveyed here, they are not satisfied. Like 30%, only 30% of the family respondents said they are satisfied here. I mean, here you can see the percentage, only those who said they are currently satisfied. So only maximum less than 35% of the respondents said they are already satisfied with the relationship with the family. But specifically, we didn't see any significant difference here. I mean, whether you are caring for old people or not caring for old people, the majority of them, they are not satisfied currently because of the impact of the pandemic, which is again expected. So briefly, because of the time constraints, so the final question in our survey, one important question in the survey, we asked family about their expectation, what kind of needs, what kind of policy they support or suggest. And as you can see here, the majority of the respondent, so here, the respondent here are those families who are caring for old people. As you can see in the bottom of the figure, that the majority of families support need more mental health support, counseling support, health coverage for all citizens. So here we classify the needs in terms of support, counseling, and leave policy, flexible work arrangement, paid leave for parents, marital counseling support, family medical care. But specifically in relation to the elderly people, we can see that the majority of those families who are caring for old people, they asked for access for elderly care and financial support for elderly. But surprisingly, again, this is an average. You can see in a figure in color, the yellow color, that the majority of respondents said that those policies in terms of financial support, leave policy, parental leave, mental health, marital counseling, are actually not already in their country, which is surprising. I mean, this is again an average. Of course, will be difference between the US, European countries, African countries, countries in the Middle East and country, but in Asia. So again, this is a very preliminary study. I'm happy to share with you more data in the future, hopefully in October. But what we can learn from the study, that we can now recommend, if we can, I know it's a preliminary study, that family needs support for caring for elderly, or not just caring for children. The pandemic, one of the lessons learned of the pandemic is the need for family solidarity, for intergenerational solidarity. But also government and civil society and all stakeholders need to support those families in terms, and support here, I mean, as you can see, this is the response from the families. They need support in terms of mental health support, marriage counseling, parenting support, leave policies, medical care, financial support. So family needs support, needs better engagement from the government, better engagement from the civil society. So thank you very much again. I'm very happy to receive any question. As I said, again, I mean, I only focus on one specific question. The study is still ongoing. We will announce the result, hopefully start announcing the result and sharing the findings in the month of November, in December. And we are planning other event to disseminate the result. Thank you again, Ignacio. Thank you again, Alex and Renata and Kinga and all our partner and colleague who supported this study.
Thank you very much, Anis. And yes, we have now some questions here for you. We have one question from VLC who says, what would be the most affected age group from the research, especially on mental health issues? Children, young adult, or elderly?
Now, I cannot answer this question specifically because I said we didn't start the data analysis yet. The data collection is still ongoing. It will end end of September. So we didn't start the analysis yet. But if you are interested, you can email me. I can send you a brief result or aggregate result. But as I said, the study is still ongoing now. Some countries are almost done with the data collection. Others are in the middle of the data collection. But yes, I mean, to answer your question, I can answer a question, but not right away, because we have all the data. We asked the participant about their age, the age of the family, and many other demographic factors.
Okay, we have another question from Victor that I think maybe he can make it by himself. Victor, are you there?
Can you hear me? Trying to do the video. I just wanted to ask that, have the COVID shown any positive within intergenerational solidarity and on the intimacy between the family members? Maybe the fact that they are spending more time together actually shown some positive results. Mothers and fathers that never really had time for their kids can actually spend some time together, get to know their kids together. Is that a thing?
Yeah, we covered that question in the survey. We asked a very specific question on the quality of the marital relationship, and then the quality of the relationship between parents and children. So we covered the as you mentioned, we try to look to the negative and positive impact. So in the questionnaire, we try to analyze whether the COVID affected positively or negatively the marital relationship, but also relationship between parents and the children, but also relationship between the parents and the larger family. Again, as I said, I cannot give you exact answer now because, again, we didn't start the data analysis. I did the analysis exclusively for the IFFD, specifically on the intergenerational solidarity. But as I said, if you are interested, please bear with us. The data will be announced. We start communicating the data in November. I saw another question. They said, are you going to compare countries? Of course, yes. So we will produce very brief country report, regional report, but also different comparative report on different sections. So we will compare to what extent the COVID impacted their marital relationship, to what extent across countries, to what extent the COVID impacted children mental health, to what extent the pandemic has affected parents' relationship, to what extent the pandemic affected women, to what extent parents affected father, to what extent the pandemic affected single women and single father, to what extent the pandemic affected children education, performance, etc. So as I said, we asked many questions. 32 questions, 56 countries until now. And we are so happy. I mean, everyone is so happy that we received a very good response. Thanks to our partner and colleague. Again, as I said here, thanks, great support to IFFD, to Renata and Kinga here who supported us in data collection in Hungary. And other partners, of course, you can see all the name of the partners and research in the website.
Thank you very much, Anis. We are getting many questions about the results and about different specific information. I think because we need to go now to the next speaker, I think the best solution will be that if you allow it, we will give to all the attendants access to the website where all the results will be published. And maybe if someone is really interested in some aspect, they can email you, because we have here some professors also who are asking about it.
Absolutely. I mean, if you have any question, please, I mean, you can email me and you can see the website to find all the information there. The result, again, is not yet there, but I'm happy to answer your question. But again, I mean, this presentation was exclusive for IFFD.
Thanks very much for it. And I think this has had the effect that many more people will be interested from now on too. Thank you very much, Hannes. And with this, we pass on to the next speaker, Professor Bahira Trask. As I said, Professor and Chair of the Department of the University of Delaware, who is going to talk about megatrends and families, specifically in relation with intergenerational solidarity. Thanks very much for being here. Bahira, you have the floor.
Good morning, Ignacio. I'd like to thank you for inviting me and Alex, and it's good to see Renata and Kinga. And good morning, good afternoon, and good evening to everybody. I have been attending the last 3 days. I have found the discussions very interesting and also very uplifting to see so many young people who care about these issues. And I think sometimes I hear people my age think that the world is going in very negative ways, and they have not seen the great interest with which you are all participating in this forum. So I have been asked to speak specifically about intergenerational solidarity. I'm going to speak about it from a global perspective with the caveat, like Anis just said, and thank you, Anis, that was a very interesting presentation and goes very nicely with what I'm going to be talking about, that there are a lot of variations between countries, but I also want to point out that there are many different experiences within countries, and they have to do with social class, education, income, ethnicity, religion, regionality, if people are living in cities or in rural areas. And so when we talk about global trends, I would just like you to keep that in mind. We are generalizing, but there are a lot of variations. So it's not allowing me to move the slides, Ignacio.
Okay, let's hope that the technician can help us, and if not, we can pass them for you for sure.
Okay. Whoop. Is this me now? Good. Okay, now it's working. So the first thing I want to talk about is fertility. The global fertility is falling. And here you have a nice little UN graphic that shows how quickly fertility is falling. Half of the world's population now lives in an area that is below what is called replacement level. Replacement level of a population is 2.1 births per woman. The only places where that is quite different are in sub-Saharan Africa, Oceania, and North Africa, and certain countries in Western Asia, where the population is actually expected to grow. Now, from some perspectives, this is not a bad thing, but that's actually not true. So as there are fewer and fewer people, there are not enough people to work in the labor force to help care for elderly, etc. We're going to get more into that. So there's great variation between countries and more coming also. Oops, sorry. So the other main demographic change is we're all getting older. We are all living a much longer time. And the prediction is that by 2050, 1 in 6 people is going to be over the age of 65. So what is happening is a first in human history. Human population used to look like a pyramid. Lots of babies being born, a few people living to a very old age. If you look at the third graph, you will see increasingly we look like a rectangle. In fact, there are now countries where there are more people over the age of 65 than children being born. So again, we don't even know what the implications of that for social life are, because it's a first, as I said, in human history. There is great variation between different parts of the world. So if you look at this graph, you see that as a sort of global area, Europe is aging the most, followed by North America, and Africa as a continent is the youngest area in the world. What a lot of people don't realize is that the largest number, not percentage, but actual number of people getting older is in Asia. And we have many countries that are not really ready for this aging, or it's sometimes called the graying of the population. So how is all of the decline in fertility and the aging of society, why should we care? For example, I live in the United States. We really don't discuss fertility very much. We discuss aging in the media, but we don't discuss fertility. And that is because as a whole, America is at about 2.0 fertility, with different racial and ethnic groups having different levels of fertility. But we're not yet in the sort of panic zone in terms of fertility. So most people are not very interested in this topic. But in countries like Japan, where you have a large percentage of elderly people, what it means is that there is a decline of people who are working in the labor market and contributing to taxes and income of the country. So that's one issue. And the second issue is that there's an increase in care responsibilities, both for families, but also for more sort of official social services, and also for the social protection plans. The second impact of these demographic changes, especially the drop in fertility, is that families, parents specifically, are investing more resources in their children. So what we're getting increasingly in many parts of the world is what are called beanpole families. That means more generations are alive at the same time. Historically, people had more children, so the families were bigger in a horizontal way. Now the families are bigger in a vertical way. Especially in high-income countries, it is not unusual for children not only to know their grandparents, but to know their great-grandparents. And there is an inheritance system that is purely, especially in the West, sort of intergenerational transfer of resources. I will come back to that because somebody, I think Victor, was asking about intergenerational relationships, and that is tied to resources. Also, there are more conflicts. There are more bonds, but there are more conflicts. When you have multiple generations alive with very different perspectives on how to live in every possible way, not everything is always harmonious. And that goes against our image of quote unquote family. The other very important trend is that around the world, we have an increased number of women in the paid labor force. On the one hand, this is very good for many reasons that we talk about at many of these meetings. You know, women have more independence, autonomy, that sort of thing. But women were also historically the ones who took care of care, all types of care, children, the disabled, people with long-term illnesses, and the elderly. So it raises the question, who is going to take care of all of this? And we will get back to this before everybody writes to me and says, well, the men should be doing it. The men are also working. So everybody is out in the paid labor force. And this raises very complicated issues, how societies what kind of policies we should have in place to support everybody so that the burden doesn't fall on one group alone. I just want to give you an example. For example, in China, there's a huge problem now with what are called left behind children. So parents, working age, early 20s, all the way maybe till late 50s, go off to urban areas to work to earn money, and they leave their young children with their elderly parents. And this has created a whole generation of children who don't get adequate services, education, that sort of thing. And China is in the process of trying to figure out policies for how to deal with this. Also, we are seeing in different parts of the world an increase in multi-generational housing, again, responses to the aging of the population. The other issue that I think we don't give enough attention to is that as our societies become increasingly diversified, we also have very different types of aging and different opinions and philosophies about roles for the elderly, relationships between the young and old. And these different perspectives coexist within the same society. And that creates a whole host of new issues. I also want to point out that aging is very different depending if you live in a high income or a low income country. This graph from the world, or this map from the World Bank, I liked it very much because it really shows some very interesting differences. The red societies are societies that are aging, that are relatively wealthy. The yellow countries are societies where people are aging, but the country doesn't have a lot of money. So again, that influences policy formation and what is possible. So in high-income Western countries specifically, there's an emphasis on people living on their own. When you survey in the United States or in Canada or in Europe, people say, I don't want my children taking care of me. I want to be on my own. You know, and there are enough social protection plans in place that allow for the elderly to live independently, often all the way to the end of their lives. So, but with the increased aging, for example, in like Japan, the aging is outpacing the available services. In low-income countries, we have an emphasis on families taking care of the elderly and the young, and a strong emphasis on intergenerational bonds. But as I was saying, migration is an issue, and also out-migration, migration to other countries to earn income to send back home. So, you know, somebody might leave, they may send income back home, but what happens as their parents, who they might be sending the money to, age? And that also causes a fracture in the relationships. So we've been talking a little bit about intergenerational solidarity. I want us all to be on the same page. What is intergenerational solidarity? Well, it is a social contract between the generations, that the generations are going to get along with each other. They're going to be dependent on each other, and it is to build a better future. We all want our children and our grandchildren to have good and happy lives. And that is what intergenerational solidarity is about. Intergenerational solidarity and social, or it's also called social cohesion, exists on multiple levels. There's the macro level, the societal level, you know, where, for example, age cohorts identify with certain events. COVID-19 is a wonderful example of that. All of us who've lived through COVID-19, we may have experienced it differently, but it will always now be a reference point for us. For example, for school-age children, all of them will have had the experience that at least for a couple of months, they were at home learning. Then there's micro-level generational cohesion. That's what actually happens within your family, how you get along with your parents, how you get along with your grandparents, your extended family, aunts, uncles, cousins, that sort of thing. It's very cultural, it's very different in different parts of the world, and it changes. It's not as what we consider the social contract and what we consider appropriate relationships is different from time to time and from place to place and culture to culture. So where do we stand from a global perspective? Well, there's some very interesting large studies on this issue. In general, there is a positive perspective on intergenerational solidarity. So there was a large 27,000 survey in Europe, and interestingly enough, 62% of people said that the elderly were not a burden. It is the older people themselves who worry that they are a burden, but as a whole, people did not feel that that was the case. Again, these topics are most salient in countries that have large aging populations. So if you look, for example, in Japan and South Korea, where you have very large aging populations, there's a lot of discourse about what is going to happen and what is the relationship between aging and the economics of the country. But as I said, intergenerational relationships continue to thrive. In fact, there are a lot of very interesting studies that over the last several years, even among wealthy families in Western Europe, intergenerational relationships have actually gotten stronger. One of the reasons they've gotten stronger is because the cost of housing has gone up, and children, adult children, are more reliant on their parents for financial help. You may say that's not a great form of intergenerational relationships, but historically, there has always been an economic and an emotional aspect to family life. So there's also data from China that siblings will help each other out, specifically with buying a house, taking care of children, that sort of thing. Increasingly, as the lifespan has lengthened, the pathway to adulthood has lengthened, and young adults are actually more dependent today on their families financially than they were in the past. That creates a type of intergenerational solidarity. Of course, there will be conflict at times, but there is a necessary type of relationship there. Also, grandparents provide a lot of care around the world for young children. COVID-19 has highlighted this because in a lot of cases, like I'm here in the United States, people were very worried they don't want to give the virus to the elderly, and thus they have not been able to have their grandparents come into the house. And it's really highlighted the exchange that is there. And then there is still a high degree of family care. I also want to point out, people tend not to talk about this at all. But if you look at transnational families, what you find is a really wonderful example of intergenerational solidarity. 1 billion people, or 1 in 7 individuals around the world, either send or receive remittances. That is money, you earn money, and then you send it to usually a family member, either in the city, in the countryside, or in another country. That is an indicator of the extreme importance of family ties, and it is something that we often do not talk about. So the emotional ties continue. Otherwise, people would keep the money for themselves. They wouldn't be sending the money to other parts of the world. The economic ties retain, and this is really facilitated these days by technology, because it is a lot easier to keep up family relationships through Skype and FaceTime and Zoom and all of these different means. So what are the challenges to intergenerational solidarity? Finances is one, a very important one. The cost of healthcare, pensions, social protection. But I want to point out another challenge to intergenerational solidarity, and that is the media images of aging. We are often bombarded with news that the elderly are the ones who receive all the benefits. They're the ones who they leech off the educational funds for young people. There's a little symbolic fight going on in the media between generations, which, as I showed you, is not necessarily how people feel themselves. So there's a politicization of this issue. Also, we tend to focus completely on finances, and we don't look at proximity or at association. What I mean by that is that, for example, in the United States, a very high number of people, I think it's around 80%, live near their parents. This is very high. This goes against the idea we have that everybody is fragmented and all over the place. So people, they may not be living together, but they live near each other. Or if they don't live near each other, they are in association with each other. You know, they talk to each other twice a week, that sort of thing. We hear a lot less about that, and we hear much more about the sort of the fight between the generations. Also, yesterday, somebody raised a very interesting and very important point, and they asked, why is the research focus not on families? This is something that I've devoted my career to, because I think this is an enormous problem. The research and policy focus is on individuals or individual groups. We talk about children, we talk about the elderly, we talk about women, we talk about fathers, but family is the natural center for all of these discussions. We all live in the context of some kind of family, however you define it. And we need to really get away from the issue of definition and just look at the intimate groups that people share their emotional, financial resources with. So a lot of the issues, in my opinion, that we have why things are not working is because the focus is not on the correct unit of analysis.
Sorry, Bahira, we are running out of time now.
Oh,
Do you think you could finish in 1 minute?
Okay.
So this time for...
Okay.
Thank you.
All right. I will skip this because I've talked about this. We tend to emphasize a family form, just the one with young children. I think that this is problematic, as I have been saying. We need to focus on unpaid care work, and during COVID, I've seen some studies during COVID-19, the unpaid care work, we've seen greater gender imbalances. Some of the progress we've made has gone backwards. COVID-19 has also highlighted that we need more family, not less family. We actually need each other. And it raises some questions that we can talk about in the discussion then, you know, sort of the relationship between government and family, ways to promote intergenerational solidarity, education, the way we plan cities, using faith-based organizations, poverty reduction, focus on work care, life flexibility, mental health services, violence prevention, and initiatives that go against, that mitigate age-based discrimination and prejudice. Sorry to have to rush through the last part of my presentation. Oh, and we need data. We do not have enough data. If we have data, then it is much easier to make recommendations for policies. Thank you very much.
Thanks very much, Bahira. And really, no, this is very interesting. I wish we could have much more time. But in any case, the presentation, with your permission, will be posted on our website so that people can have access to it. There was a question from VLC. I don't know if you will be able to do it by yourself, VLC, or you want me to read it?
Please read it for me. Thank you.
Okay, I will. So let me try to find it now. He says, what would be the practical suggestions for the family to promote intergenerational solidarity inside it?
That's a very good question. You know, communication and assistance that does not have strings attached to it is one way. So I think the more people, one of the things, somebody was asking about during COVID-19. So in some families, there are a lot of studies starting to come out on this issue. In some families, there's been more stress and strain, but in other families, parents who've always been working, they've been at home with their children. And just the mere fact that they're getting to spend more time with each other, doing very simple things, walking, eating meals together, cooking together, just sort of simple activities. And in doing those activities, communicating with each other, that causes more harmonious family relationships. I was talking about economics, and one thing I always worry about when I read about, economics strengthening intergenerational relationships, I know that in very wealthy families, there's some research, parents control their children through money and resources. And I think when children, though, feel that their parents really want to help them, that this is not tied to, I help you with the down payment for the house and you'll take care of me when I'm old. When it's not that quid pro quo, I think that strengthens intergenerational relationships.
Thank you, Bahira. And the last question would be from Pedro Holanda in Brazil. He says, policies are designed not just on individual level, but ignoring the family reality. How can we influence a more family-focused, governmental focus? What are the most effective ways of promoting it? I think this relates to the end of your presentation.
Yes, exactly. That is my whole career has been devoted to this, because I just see a huge flaw in the social sciences by ignoring the family level of analysis. And that has led to a whole series of policies that are not necessarily family friendly. The first thing we need, and I apologize because I ended up having to rush at the end, we need data. A lot of governments do not collect family level, household level data about what are the needs of families, what are the relationships within family, family within the community, family to schools, family to workplaces, family to social and health services. The more data we have, then we can make policy recommendations and we can present those to states. So I really believe in an empirical, data-driven approach to policy making.
Thank you, Bahira, and thanks very much to you and